I feel the most important thing we've done is to establish close relationships with the people here. There's a wonderful trust being built, and this is so vital to the work we do at the community level.
It's very important. It's as I usually say, it's not that we do the work, but it's how we do the work. I think that the work that we're doing here is really building a bridge between Rio, rural Bolivia, in the jungle, and Santa Barbara, California. So I think building the bridges of culture, of understanding the common dynamics of working together to provide medical care to people that have never had it before, it's absolutely, it's what keeps me going in this work, and I know that's what keeps the staff going here too. When you hop in the boat and you're spending 4 or 5 days together, staying in local huts, eating local food, camping out in tents along the football field, you become quite close. So when you're off 3 to 4 days downriver toward the Amazon basin area, it's hot, it's not the best conditions in the world, but when you have a staff like we have, it's a great camaraderie. We laugh a lot, we work very hard, but at the end of the day, we all sit down together, usually have a local meal together, and it just feels like a very, very tight team. That's going to be the key for this project to extend year in and year out and do the work that's really needed here.
Un aplauso para todos.
This is the story of a health project, created on friendships that Dr. Netzer made. The friendships with the Bolivian people he lived with, and all his long-term friends from the United States that supported and helped him create this vision. It was a bond of humanity, 2 cultures creating one project. With the help of all, the project grew, from the bottom up, grassroots on the banks of the Beni River. Lou was just the beginning, a beginning that still fuels all those involved. In September of 2002, Lou went back to Rio, this time not to charge up the river or travel the dirt road, but to say goodbye. 8 months earlier in California, he had been diagnosed with terminal cancer. It was his deepest wish to return to the people he had lived with for 5 years. And for the first time, the local governments formally acknowledged his commitment and aid to the people. He died 1 month later. Now the future of the project lies with those who continue his work. The work has a foundation and a structure, but it is just the beginning. The initial group of promoters has finished its first full year of training. Soon they in turn will be able to go on and train other promoters and provide basic medical assistance to the people of their communities. The staff continues their visits, the doctors giving primary health care that is saving and improving lives. People expect them. They recognize the blue boat, the Toyota truck, the camaraderie. The project is growing and has the potential to become much more than one man's vision. This is a project that will continue with the people of the Rio Beni.